Hi everybody, welcome to Dr. Sam's anatomy classes. Here I'm going to solve these 20 MCQs on general anatomy. These questions are from the first midterm exam conducted at Rajashree Medical Research Institute, Bareilly on 6th of March 2021. This test was for MBBS 2020 batch. Now question number 1 is regarding Langerhan cells. Langerhan cells are predominantly found in which layer of the epidermis? Stratum basale, stratum spinosum, stratum granulosum, stratum corneum. Now keep listening and focus on what I'm drawing. This is the dermo-epidermal junction. On the basement membrane, you find these cells, the cubical cells resting on a basement membrane in a single layer. This is called stratum basale. Now, because it is a continuous state of actively dividing, so this is also called a stratum germinetivum. And those cells which you find in phase of mitosis, they actually elongated or columnar in shape. Then above to this, you find is another layer. Now, this another layer is made up of stellate shaped or spiculated cells, spinous cells. These are arranged in 2 to 3 layers, and they're also called prickle cell layer. This is also called prickle cell layer. Remember, if there is a hypertrophy or hyperplasia of this layer, that leads to the prickle heat formation. That's called gonorrhea in Hindi. Then above to this, you find is another layer that is like polygonal cells. This again is also multi-layered epithelium. Now these polygonal cells arranged multi-layered 3 to 4 layers. They have this protein deposition, and that's called keratohyalin. And this layer is called stratum granulosum. Above to that is a special layer in thick skin, right? In thick skin you find this additional layer, the fourth layer from below, and this is called stratum lucidum, because they have this protein called illidine protein, which makes this skin appear translucent. So because it's a feature of thick skin, like this is a feature of thick skin. So thick skin, is present in palm and soles, not a feature of thin or hairy skin. You don't find it in a hairy skin. Then the top layer is, the flattened squamous cells. These flattened squamous cells, like this is the thickest layer in both the thin and thick skin, and this is loaded with protein keratin, right? And because of these flattened cells on above, the epithelium of skin is called stratified squamous epithelium. Talking about Langerhan cells, in the question, Langerhan cells actually are present in all the layers, right? So there's asked if they ask, like, they found in which layer of the epidermis, so they actually are found in all the layers of the epidermis. Langerhan cells, what I'm drawing, is present in all the layers of the epidermis. So Langerhan cells, these are dendritic cells, like, they have this protoplasmic dendrites radiating out and reaching up to the different layers, right? So these are dendritic cells, and they are part of immune system, right? Just like you have macrophages in the tissues, here you have is the dendritic cells. Now these dendritic cells are actually, origin wise, they are actually derived from a hemopoietic lineage, the myeloid cell lineage. And they actually, right from the embryonic development, right from the birth, it actually is these hemopoietic progenitor cells. They're actually in the skin, and they keep on dividing to form these Langerhans cells. So um, these one of the important thing about this is that in these cells you find granules. These granules within these Langerhans cells, these are called Birbeck's granules. Birbeck. Birbeck granules is a feature of Langerhan cells. So these are Langerhan cells. Okay, what else you want important about is, of course, they are like first line of defense, and they are like macrophagic in action, phagocytic in action, providing first line of defense. And in case like if they ask like because they have asked here in this question is about predominantly found, right? So if it's asked predominantly, then your answer will be stratum spinosum. Remember, this Langerhans cells is predominantly found in stratum spinosum. Another question they might ask sometimes is about the different other type of cell, and that cell is yes, they might ask where do you find is melanocytes, the pigment cells. So melanocytes are seen in stratum basale. They are part of stratum basale. Now question number two. Question number two is about most painful burn. Most painful burn is first degree burn, second degree burn, third, or the sunburn. So let me tell you now that about the burnt area. Thing is, this is dermo-epidermal junction. Here you find is the epidermis above. This is the epidermis. Then you have is the dermis, and below to that is the hypodermis, right? And of course, this is the superficial fascia, right? This is superficial fascia. This is dermis. This is the dermis, made up of like hair follicles, sweat glands, sebaceous glands, blood vessels, and everything. And the top layer is the epidermis. Epidermis is what I have already told you. So here it is epidermis. Now talking about degree of burn. So when there is first degree of burn, this I think I am drawing here is, let's say this is the first degree burn, and the second degree burn is actually this burn which passes through this dermoepidermal junction. This is the second degree burn, and third degree burn is actually passing, it's completely destroying the dermis and reaching to the hypodermis, even sometimes down, even burns the deep fascia also. That you can assume is the third degree burn. So what have you seen? Like in case of first degree burn, let me tell you the examples. Like if you are, if your skin gets touched for short duration to something hot, and like there will be pain, redness over to that surface, and gradually, like if you rub it with the hot or cold water, chill water, you place an ice cube over that, it might soothe it. But gradually after a few days, you'll find that portion of the skin gets peeled off. So initially, of course, is pain in first degree burn, but it heals easily in few days. But the second degree, now talking about the second degree, is like when there is like boiling liquid, like let's say oil that spills on your skin. So what happens now is like there's enough of pain, and there will be blister formation gradually, and those blisters will gradually then peel off. So what happens is like the second degree burns, the because I told you it's we're talking here is about this, the dermoepidermal junction. And you also know that the neurovascular plane running in this hypodermis they all cross this dermis and reach to the stratum basale, the basal layer of this epidermis. So the nerve endings, right? So the stratum basale is like, there are nerve endings reaching to this layer, the basal layer of the epidermis. So whenever there is injury to the basal layer of the epidermis, there of course will be the free nerve endings which will get exposed, right? So remember, when it's the second degree burn, there is like peeling of skin, the blister formation, and there will be the free nerve endings that will get exposed, right? After this, blisters get ruptured. So this type of injury is like very painful, the second degree burn, and even if you blow air over to this burnt area, there will be pain. Or if the patient is lying below the fan, then also it will be painful. So such patients are actually covered with something which is not touching to the surface of the skin. They have a protection, so that it doesn't provide gives them enough of pain. Then third degree is actually when the entire skin gets burned completely. There's formation of char, like it's like everything burned out. It's a coal. So what happens is the entire skin gets damaged. There will be char formation. The patient will it will appear as like whitish thing, or maybe completely black. If it's peeled off, you might find it something whitish. Otherwise, it becomes completely black. So, you know, treatment wise, of course, the third degree is like most promising, because you have to go for skin grafting and all. Um, and even the underlying tissues, the tendons, the ligament, the muscles, the bone, sometimes they may get burned if it's type 3, a third degree burn. So now the answer to this, the most painful burn, is the answer should be second degree burn is most painful. And if they ask like which degree of burn is painless, like after burn I'm talking, most, I mean the painless degree is third. Third degree is painless. This one is painless. Like not at the time of being burned, but after that third degree becomes painless, and second degree is most painful. This is most painful. In third degree, remember, you need skin grafting. Sunburn, now sunburn is actually same as first degree burn. There is just like the stratum corneum, the top layer of the epidermis, they get burned out and they gradually peel off with time, and gradually they heal up. So sunburns is not the same as nearly as first degree burn. So the answer is most painful burn is second degree burn. Question number 3 is correct about apocrine sweat glands. You should know what apocrine sweat gland is. They are more in the thick skin, more around the nape of neck, more in the axilla, watery secretion. Again, this is about the skin question, related question, so you should know that this is the dermo-epidermal junction, and from here the stratum germinetivum, the basale, this distance down as in the form of hair follicles. Then you have the sebaceous glands, and then is the dermo-epidermal junction. And what comes out from here is this hair follicle. Now, and you also know that there is this, what is this? Erector pili muscle. So together the three things, the hair follicles, the sebaceous glands, the erector pili muscle, together they constitute the, what is this? This is called the hairy apparatus, and hairy apparatus is a must feature of a thin skin. A thin skin is a hairy skin. About the sweat glands. So you know that there are about two types of sweat glands, right? So all these glands are ectodermal, right from the surface of the skin, these glands, they descend down and invaginate and form this elongated coiled tubular gland. This is how it is, and this is called eccrine sweat gland, one which opens onto the surface of the skin. Other one is one which opens into the hair follicles, right? So those glands, those sweat glands which open into the hair follicles, these are called apocrine sweat glands. The difference between eccrine and apocrine sweat glands, remember that eccrine is like when you sweat because of temperature, like playing in the sun. And that sweating is mostly from, remember, the maximum amount of eccrine glands you find is on the palms and soles. That's the feature of thick skin. The secretion is watery in case of eccrine sweat glands, watery and salty secretions. The feature of eccrine sweat gland predominantly seen in the palm and sole, and of course found on the forehead, the nape of the neck, on the side of the cheeks, and everywhere, of course, in the body. What you when you sweat because of temperature, that is eccrine, and of course also because of anxiety related sweating is because of this eccrine sweat glands. Now the yellow color glands which I have drawn, they're also coiled tubular glands, apocrine sweat glands. Now apocrine sweat glands, the secretion is not watery, rather it is somewhat lipid based, and like it is somewhat sticky also. Just like remember somewhat to that of secretions of sebaceous glands, apocrine, because they're opening into this hair follicles. So, and that means there must feature, that means you need to have hairs to have these apocrine sweat glands. So that means they are found in these areas where the hair is. Now here also there are three types of hairs. What are the three types of hairs? They are androgen dependent, which are found only in those sites which are we find hairs after the puberty, the pubertal hairs, axilla, pubic area, beards, and all chest hairs. So those pubertal hairs you find is they're androgen dependent. Of course, there are androgen sensitive hairs on the scalp of the males, and which easily shed because of those dihydrotestosterone (DHT) hormones. And androgen independent are those like right from the birth they are present on this entire human skin. So these are different types of hairs. Now, the androgen dependence hairs, like the hairs which come out as a part of the secondary sexual characters, those hairs, they have these apocrine sweat glands which open into the hair follicles, and of course they liberate this human body odors. The pheromones that the body smell is because of those apocrine sweat glands. Got it now? So now you can guess the answer, that the correct statement about the apocrine sweat gland is, answer will be, they will be more in axilla. Next question is, total number of long bones in human body is. This one is a very easy question. Long bones in human body, right? So in the appendicular skeleton, you find is humerus, radius, ulna. Then you have is femur, tibia, fibula, and the long bone lying horizontally in the body is clavicle, right? So you have, and of course these are paired. So you have number one, two, three, four, five, six, seven. 7 into 2 will be 14. C. Total number of long bones in human body is 14. There's a big lecture on growing in of long bones, all about the long bones. You can watch that lecture in my playlist. Then, how to calculate the percentage of burnt area on the anterior abdominal wall of a patient? So, options are rule of 9, by the size of the patient's own palm, by the size of the clinician's palm, by using measuring tape. So this question I put up to just to revise the two important facts, and that is about the rule of nine. Rule of nine. Now, rule of nine is actually applied to calculate the body surface area. Of course, like for different age groups, they will be of different percentages, but here I'm telling you is about the, you know, in an adult, in an adult, the surface area is somewhat different, and in a child, like when I'm drawing here, is about less than 5 years. In a child who is of less than 5 years, the percentage area will be different. So in this head and neck region in an adult, this is 9% in the front and plus 9% behind. Right, total head and neck is of 18. And I think I should better write it so that it doesn't give confusions. It is actually 18%, which is equal to 9 plus 9. Front and back of the head and neck. Upper limbs is actually completely 9%, and this is actually 4.5 plus 4.5%. Right? So this is about the arms, front and back. Not the arms, the complete upper limb. Then about the trunk. The trunk is actually 18%, and if you divide the upper half of the trunk, then it will be 9% above half, 9% lower half, and the same it is equal to this is 18 plus 18, front and back, or you can say 9 plus 9 plus 9 plus 9%. That makes the complete trunk, front and back. Lower limbs is 18%, and that is 9 plus 9, front and back, right? So same both the sides, it will be 18%. The remaining 1% is said to be of genitalia. However, some authors consider 1% to be of neck region also. Now, in a child less than 5 years, I'm writing here because, you know, less than 5 years. Actually, if you talk about 10-year-old child, there will be some difference in this percentage calculation, or even like 15 years, again, it will be different. But what generally is asked is about the child, means less than 5, and an adult. So here the percentage area now, because head in a child comparatively to adult is like, the percentage of the head is enough. So in a child, it is 18 plus 18. The front and back of head and neck is together 18 plus 18, and same will be the case of this trunk. This also will be 18 plus 18. Okay. Then about the upper limbs will be 9%, right? Upper limbs will be 9%, both the sides, like, that again 4.5 plus 4.5. And the lower limbs now here, because this portion of percentage has been taken up by the head and neck region, so it becomes 14%. Remember, 14%, both front, means what, 7% back and 7% front of the lower limbs, so that makes 14%. And the genitalia still remains nearly 1%. So somehow, now this is like an average, like, some may consider like this portion, maybe like 10%, the upper limbs. As the age progresses, if you go into this details about the burn books on this plastic surgery and all, they will give you details. But this is a rough idea. Well, if you understood about this rule of nine, now to tell, let's discuss about the question now. the question is about the percentage of burn area on the anterior abdominal wall of a patient. Now, anterior abdominal wall, what is anterior abdominal wall here? It is this anterior abdominal wall in the question. So, if you to calculate a area of burn here on the front of abdominal wall, what can you do? Because it's complete, the front in the abdominal wall is around 9%. So the best thing is, like, there's less of space, although you consider I'm drawing it here that this is the anterior abdominal wall of a subject with the umbilicus here, and you can imagine that the subject places his own hand here. So the area of the skin underneath to the subject's own hand is about 1%. So, because the clinician may be different clinician touching this, investigating the same patient, so that might differ because of different clinicians. So it's always preferred, this criteria of measuring your own palm is of patient's own palm is the criteria of measuring a small area on somewhere on the reachable parts of the body. So the size of burn area on the reachable parts of the body, if it's smaller in size, you can easily measure the area by asking the subject to place its own hand on to calculate the approximate area of burn. So remember, on the area of hand is equal to 1% of the body surface area. So you can remember that you need 100 of your palms to cover your entire human body. Okay, so the answer here will be B, the size of patient's own palm. Then next question is duodenum is derived from. Duodenum is derived from. Okay, so that what I'm drawing here is the foregut, midgut, hindgut. Foregut, midgut, hindgut, and you have the dorsal aorta in an embryo, and the median unpaired branches of the abdominal aorta. One is the celiac trunk, then you have the superior mesenteric artery, and then you have the inferior mesenteric artery, right? This is how it is. This is celiac trunk, and this is superior mesenteric artery, and this is inferior mesenteric artery. So, and this you presume as foregut, midgut, and hindgut. So all the structures derived from the foregut, they will be perfused by the branches of celiac trunk. Now the structures derived from foregut will be the distal portion of the esophagus, then stomach, and the first portion and the upper half of the second part of the duodenum. Those all structures will be derived from foregut. And remember, hepatic bud, cystic bud, pancreatic bud, they all are arising from the foregut. So pancreas, liver, and this gallbladder, and even the spleen that develops in the mesentery, dorsal mesogastrium. So All these structures, they will be perfused by branches of celiac trunk. Then midgut, what will be the structures derived from the midgut? It will be the lower half of the duodenum of the second part, then third part, fourth part of the duodenum, jejunum, ileum, cecum, appendix, ascending colon, and the right two-third of the transverse colon. They're all derived from the midgut. What all derived from the hindgut will be the left one-third of the transverse colon, the descending colon, the sigmoid colon, the rectum, and the upper one-third of the anal canal. Junction between foregut and midgut, if they ask, is happening at the second part of duodenum. Second part of duodenum. Then this junction between midgut and hindgut is between right two-third and left one-third of the transverse colon. Got it now? So, if and these arteries actually anastomose, like this branches of celiac trunk. If they ask, where will this what branches of celiac trunk anastomoses the branches of superior mesenteric artery? So, superior pancreatico, duodenal is a branch of celiac trunk. This superior pancreatico-duodenal is a branch of celiac trunk, and inferior pancreatico-duodenal is a branch of superior mesentery, and they're anastomosing here at the second part of the duodenum. So I hope you got the answer now. That which part of the duodenum is derived from duodenum is derived from. So you can see that the duodenum is being derived from this much portion, right? Foregut and midgut. Answer will be both foregut and midgut. Then next question is, active mitosis is seen in cells of stratum basale of epidermis, stratum spinosum, stratum granulosum, stratum corneum. This I already explained above in one of the questions. So you know that stratum basale is also called stratum germinetivum. Stratum germinetivum is the basal layer of the epidermis, which is continuing the state of mitotic division, especially in the exposed parts. And um, so you'll find active mitosis there in stratum basale of the epidermis. So the answer, of course, is stratum basale of the epidermis. Wrong about superficial fascia. Next question is wrong about superficial fascia. It forms the body contours. It is the cutaneous, near the neurovascular plane. Sebaceous glands are present in it. It is made of blue connective tissue. So again, just a fast revision here. You find is this as the epidermis. Then you have the dermis, and then you have the hypodermis, and then you find is the deep fascia. So this layer we are talking about in the question is this layer. Now this is called superficial fascia, also called hypodermis, also called subcutaneous layer, right? So the important features about the superficial fascia or hypodermis is that it has neurovascular planes. The nerve and vessels will be running from here, and it will be supplying hair follicles, sebaceous glands, sweat glands, and even the stratum basale. So you will find the arteries, subcutaneous veins also running in this, right? And you will also find the, you know, cutaneous nerves also running in this, cutaneous nerves also. And what else? You will also find lymphatics also running in this, superficial lymphatics. They also reach into the dermis from this layer. So one thing, the another important thing is about this layer is that it is the neurovascular plane of the skin below to the subcutaneous layer. So it forms the cutaneous neurovascular plane, one thing. And remember that this layer has a lot of adipocytes. It is filled with fat, a lot of adipocytes. So you have a lot of fat here. And because of this fat here, this is fat or adipocytes. This subcutaneous fat is having different functions. One important function is it acts as it provides heat and provides, actually, it doesn't provide heat, actually acts as a insulator. It prevents the loss of heat, one thing. Then it provides body contours, like the shape of the body, especially like in the secondary sexual characters. The amount of fat is differentially distributed in both sexes. It's more in the arms and more on the thighs and the buttocks in case of females, apart from the breasts. And in males, there is more of pendulous abdomen, like it's around to the abdomen. There is more of distribution of fat, so that gives the body contours. And of course, at certain places where you don't have this amount of fat, instead there you find you have loose areolar connective tissue below to the dermis, right? So, and one more thing is, yeah, uh, you know that this was the hair follicle. You had here hairy apparatus here. Sebaceous glands, remember, sebaceous glands are actually derived from the hair follicles, and sebaceous glands are a content of dermis. Okay? Sebaceous glands are seen in the dermis. They are, of course, derivative of epidermis, but they present in the dermis. So the answer will be sebaceous glands are present in it, which is a wrong statement. Okay. The next question now is question number 15. Wrong about sympathetic nervous system. Preganglionic fibers are short, postganglionic fibers are long. Has a diffuse response, helps in ejaculation of semen, helps in voiding of urine. So you know that this preganglionic fibers, they arise from the lateral horn of the spinal cord, and they will relay in the sympathetic ganglion, which is like a beaded chain on the side of this vertebral column. And from there, these postganglionic sympathetic fibers, they emerge out. And this, oh, hold on, this postganglionic fibers are really very long, and the passage to the sympathetic ganglion for the preganglionic fibers is through this, you know, white rami communicantis, and it emerges out through gray rami communicantis. So the preganglionic fibers, why? Because white rami, because they are myelinated, and the postganglionic fibers, they are mostly Unmyelinated in case of sympathetic nervous system. This is preganglionic fibers, sympathetic fiber. This is postganglionic fibers in case of sympathetic outflow. So preganglionic fibers are short, you've seen it, and they will be present only from T1 to L2 spinal segments, right? And postganglionic fibers are long, you know that. The postganglion fibers actually, these preganglionic fibers, they might ascend up into the cervical region, they might descend into the lower lumbar and sacral regions as well, because this postganglionic fibers, they will emerge on with their corresponding spinal nerves and all. So a diffuse response, of course, it will be a diffuse response, because they are slowly conducting and they are non-myelinated fibers, the postganglionic fibers, and they act on the different systems simultaneously, like, tachycardia, breathlessness, mydriasis, and all of this, vasodilatation in this skeletal system, musculoskeletal system, all this happens simultaneously. So it's a diffuse response. How does it help in ejaculation of semen? Basically, in males, this this urethra in males is actually a urogenital passage. So, in the prostatic part of the urethra, it's the ejaculated ducts that drain, that open there. So while there is, like, this ejaculation about to happen, there is, like, there has to be sympathetic system. The role of sympathetic system, the GIT, is actually to constrict the sphincters, and also in this, the rest of this, mostly it's like constrictors in the viscera. So this internal urethral sphincter at the neck of the bladder has to be closed, because the semen, it's just to prevent the retrograde ejaculation. The semen should not reach into the urinary bladder. So to prevent that retrograde ejaculation, the internal urethral sphincter has to be closed at the same time. So it's helping in ejaculation is actually by preventing the retrograde ejaculation by constricting the uh, internal urethral sphincter. Now, talking about urine, just now I told you that sphincters are actually closed because of this sympathetic outflow, and the relaxation or the dilatation or the relaxation of the sphincters is because of the parasympathetic outflow, which is precisely controlled. So voiding of urine will be the relaxation of the internal urethral sphincter, and of course that will be a parasympathetic response. So your answer wrong. They have asked is the wrong about sympathetic. So answer will be helps in voiding of urine will be the answer here. Okay. And remember, in parasympathetic, the preganglionic is longer neuron and postganglionic is very short neuron. Okay, so that was about this 15. Now we'll move to next question. Question number 16 is glial cells of CNS are all except glial cells. So glial cells are actually the non-conducting cells of the nervous system, like supposed to be the connective tissue of the nervous system. So the connective tissue cells in CNS are actually uh, fibrous astrocytes, protoplasmic astrocytes, microglial cells, plus oligodendrocytes, right? So all these cells, they are glial cells of the CNS, while this, you know, Schwann cells, they are glial cells of peripheral nervous system. You find that these Schwann cells, they form the myelin, urilemma of the peripheral spinal nerves, and as well as in case of peripheral cranial nerves. So answer here is D. Next question is next question is question number, oh, I was going randomly, that means okay. The question number 5. Blood supply of ulna is by. For this, you can go back to my playlist. You can watch that lecture which I've uploaded in detail about the blood supply of different long bones. There you get to understand the clear funda about all this. But in short, let me brief a blood supply of ulna is by. So the answer here will be anterior interosseous artery. And remember, anterior interosseous artery supplies both the bones of the front of forearm, both the bones of forearm, radius and ulna, both. And anterior interosseous artery is the continuation or the main continuation of common interosseous. The minor branch is the posterior interosseous artery, and common interosseous artery is a branch of ulnar artery. Rather, it is the largest branch of ulnar artery in the forearm. I hope you got. And by the way, what will be the direction of this nutritional artery in ulna? Proximal or distal? So for this, remember, there are two funda. Either you remember the mnemonic. Mnemonic for the direction the nutritional artery was. What was the mnemonic? Remember, if this was the fetus, I told you, and this is the upper limb, and this is the lower limb, right? This is the fetal lying position, and towards the elbow we go, right? This is how. And from the knee we flee. This is one concept of remembering the direction of nutritional artery, right? Or one, so here you're saying the direction of nutritional artery in humerus will be, sorry, in ulna will be directed proximally, like towards the upper end. Or the other way is remembering the growing ends, and you can remember that the nutritional direction, nutritional foramen will be directed opposite to the growing ends, and opposite to the growing ends will be in the same fetal lying positions. The end of the long bones towards the head will be the growing ends. Upper end of humerus, lower end of radius ulna, lower end of femur, upper end of tibia and fibula. They're the growing ends. Okay, so the direction of nutritional artery in ulna will be proximal towards the upper end. Question number 6. An example of vasa vasorum is. So what is vasa vasorum? Vasa vasorum is an artery through the artery, right? So because you know there are arteries of different caliber, like this is a large size artery, then you have is a small size a medium size artery, and then you have a small size artery. And as the blood is flowing, actually it passes like this and reaches to the capillary bed. Because of the thickness of this large artery, as you know that tunica media has a lot of elastic fibers here. This is also called as elastic artery, and this one is large artery or elastic artery, and this one is medium size artery, also called muscular artery, because you have more of smooth muscles in the medium size artery and small artery. So this is small artery, muscular artery square. So what actually vasoconstriction and vasodilation? Autonomic nervous system acts on the smooth muscles, right? So vasoconstriction, vasodilation is a phenomenon of small and medium size artery, right? Large arteries are having elastic recoil, like ascending arch of aorta, descending aorta, and all. So because but humans have this closed circulatory system. So heart actually is a part of this closed circulatory system, and heart also is actually a dilated vessel, right? So you have a right heart, which is a part of this pulmonary circulation, and you have a left heart, which is a part of the systemic circulation, and like blood continuously keeps flowing through that. So, considering to the heart with the dilatation of this closed circulatory system, the musculature of the heart is very thick, right? Made up of cardiac muscles. So, Blood supply to a large artery. Let me tell you, if a branch arises from this artery, right? Let's say a branch arises from this artery and perforates to supply this large artery like this. So now this you are seeing is called vasa vasorum, right? So a branch of an artery perfusing the walls of the large artery is called vasa vasorum. And because heart itself is a dilated large artery, I mean dilated thicker portion of this closed circulatory system, which is made up of this cardiac muscle. So that cardiac muscle is being perfused by a branch of this ascending aorta. What are this like? Ascending aorta is like itself is a large artery, and a branch is arising from ascending aorta is anterior and posterior coronary arteries. And what does this do? They actually supply the muscles of the heart. So remember that coronary artery is the best example of vasa vasorum. Okay. Then next question is example of fibrocartilage is. So you just have to mug up these examples of fibrocartilage. Of course, you have collagen type 1 here. The fibrocartilage examples, you can learn them up. One is the intervertebral disc. Then you have is pubic symphysis. Then you have, that basically the secondary cartilaginous joint is a feature that you have this articular fibrocartilaginous disc placed in between. Then otherwise you have the menisci of the knee joint. Then labrum. Labrum in case of ball and socket, like glenoid labrum of the scapula, acetabular labrum of the hip bone to deepen the sockets. So they are also made up of fibrocartilage. And interarticular discs, intra-articular discs, like in the sternoclavicular joint, acromioclavicular joint, and lot many other joints, you have this intra-articular disc, right? And even a fibrous disc separates ulna from the wrist joint. By the way, just to remind you, important thing here, there was actually a question regarding TMJ. Remember that TMJ, temporomandibular joint, the disc there in the TMJ is not a fibrocartilage. Rather, it is a fibrous tissue because it is presumed to be a degenerated portion of tendon of lateral pterygoid. Lateral pterygoid muscle. So TMJ, you will not say it is fibrocartilage, it is a fibrous tissue. Okay, then answer, of course, you got it here. So the answer will be fibrocartilage. Coastal cartilage, of course, not is the answer. Nasal septal cartilage भी नहीं, auricular cartilage भी नहीं है. Articular cartilage, by the way, what are these cartilages? Coastal cartilage, nasal septal cartilage, articular cartilage, all are these examples of hyaline cartilage, right? So your answer to this question will be yes, menisci of knee joint. I've already mentioned. Then next question is question number 8. Most commonly used position for per-rectal digital examination is knee elbow position, lithotomy position, prone position, left lateral position. Actually, knee elbow position. For knee elbow position is like uh, uh, I should draw it like this. Knee elbow position is like this. Knee elbow position is like this. Now in knee elbow position, this per rectal digital examination is no doubt the ideal way. It's like it can be done, no doubts. uh, it will be easy for the clinician, but it's really very embarrassing and uh, very less of compliance you'll find in this. The patient will feel very awkward in this position. So this is not because the question is about the common. Remember, the word used here is most common position. The common position will be uh, will like subject lying down on the bed here, and you ask him like to fold his legs first of all in the left lateral position. In the left lateral position, ask him to fold his, this is can you imagine what I'm drawing is it is a couch, right? So this is here a couch. So ask the subject to lie down in the left lateral position, um, folding his legs and uh, approximating his knees towards the chest. That is how this position is called left and easy for per rectal digital examination. So this is called Sims position. Sims position or left uh, li- hold on. Left lateral position, and this is knee elbow position. So this you can remember that this is an ideal way, and this is the most common position for per digital or per rectal examination. Per rectal digital examination. Answer here will be left lateral position. Question number 9. Question number 9 is epineurium of a peripheral nerve. Question number 9 is epineurium is dash of a peripheral nerve. Most superficial covering, middle covering, innermost covering, another name for lemma. So just listen here. You have this a peripheral nerve, right? And if you see layer by layer, then when you found that this neurilemma actually includes this perilemma. Sorry, this outermost covering here it is epineurium. Then you have perineurium, and then you have is endoneurium, endoneurium, and then you'll find is the bundles of the micelles of nerve fibers surrounding to this nerve bundles. And if you pull out them, you'll find is a nerve or an axon. Now these axons are lined on outside by these Schwann cells, and you have these nodes of Ranviers in between. So these are Schwann cells lining, and then Schwann cells actually wrap around the axon in, they have this pycnotic nucleus, and this is how you find in the Schwann cells. So inner layer of the when this Schwann cells roll upon neuron is this is an axon, right? And this is the Schwann cell that wraps around to this uh, axon. So what you'll find that nucleus of it will be pycnotic on the outer layer, while now the inner layers, now inner layer of this Schwann cells, they will form myelin, myelin covering, and the outermost covering is called neurilemma, right? And this cell is Schwann cell. So I hope you understood the layers of the peripheral nerve. So epineurium of a peripheral nerve is, answer will be, what will be the answer? Most superficial covering. Another name of neurilemma? No. Neurilemma is another important point about neurilemma. Remember that it is like a it is actually must for the regeneration of an axon. If neurilemma is intact, the axons can regenerate. Okay. Then question number 10. Lining epithelium of bronchiole is. So remember bronchus and bronchiole, the differences that bronchus up, this airway, conductive airway passage, right from this uh, nostrils, right from the nostrils. Okay, this conductive airway passage, it's like this. Here you have is the larynx, then trachea, and trachea divides into left and right principal bronchus, right? So what have you seen till now? It's this passage. Now the lining epithelium of this much passage, right from the nasopharynx, then laryngopharynx, then trachea, then primary bronchus. The lining epithelium of this tract is by pseudo-stratified ciliated columnar epithelium. And secondary bronchus, from secondary bronchus, which is like 3 on the right side, 2 on the left side, and secondary, then tertiary, right? Then number of ramification of branches and all, then terminal bronchioles. After tertiary bronchus, there's a name, the name gets changed and it's called bronchioles, right? And bronchioles further ramify around 15-16 generations, and then they reach to form this terminal bronchiole. The diameter of a terminal bronchiole is 1 millimeter. Remember, 1 millimeter is the diameter of terminal bronchiole. And from there, then it is the respiratory bronchioles, and from respiratory bronchiole, you have alveolar sacs, alveolar ducts, and alveolar sinuses, alveoli. All this, this is respiratory bronchiole. And this one is terminal bronchiole. So, and the lining epithelium of respiratory bronchiole will be, respiratory bronchiole and the respiratory unit, rest of it, including the alveoli. This will be by simple squamous epithelium. So what will be the lining from secondary bronchus up till terminal bronchus? It will be by the lining epithelium here it will be by simple columnar ciliated epithelium. Simple ciliated columnar epithelium. So that was about the epithelial portion. uh Pseudostyphoid, yeah. So remember, and if it's like asked the difference between bronchus and bronchiole, the major difference is that the bronchus, you use this word bronchus up till primary, secondary, and tertiary only, right? And those in the tertiary bronchus aerate the bronchopulmonary segments. So the bronchus is one which has cartilage in its walls, right? So when this airway passage is devoid of cartilage, then it's called bronchioles. So all this is important for your revision. I'm keep reminding you of important facts. Then the answer is lining with the bronchiole will be simple columnar ciliated epithelium. Remember this. Okay, so question number 10 is done. Now let's move to the next question. Not a part of excretory system. It's so easy. Excretion is anything, removal of any sort of waste outside the body, right? So skin, of course, the sweat glands, sebaceous glands, then Eccrine sweat glands. What are they doing? They're actually removing this, minerals and this waste products. So even the water is being eliminated from the body. So skin is also part of excretory system. Lungs also, exhalation. It removes the CO2. Then kidney, of course, it eliminates the urea, ammonia products by the waste products. So not a part of excretory system will be. Answer is liver. Prime function of liver is metabolism. All are derivatives of epidermis. Question number 18. Hmm. So again, this is how it is, and this is the dermo-epidermal junction, and this is a different. Yes. So what actually you are seeing is derivative of epidermis will be sweat glands also. Sweat glands also derivative, both apocrine and eccrine sweat glands, sebaceous gland, hair follicles, all of being derivatives of epidermis. What is actually leather? If you talk about leather, leather is actually because of this ir, uh, you know, uh, irregular, densely packed up collagen fibers in the reticular dermis. This actually forms the leather, right? This actually forms the leather because the down below is superficial fascia, right? And superficial fascia is a neurovascular vein. It has like all of adipocytes and loose areolar connective tissue and all. So what is being used is leather is the reticular dermis. So answer here will be already epidermis except of course leather. Leather is not derived from epidermis. It's derived from reticular dermis. Next question is wrong about ovary. Ovary is the choices are abdominal structure, descends during development, covered by peritoneum, present since birth. So let me tell you, because this will be taught in detail in abdomen and pelvic anatomy. So I hope you got the guess by now. The answer will be yes. So remember, ovary will be taught to you in pelvic anatomy. That means ovary is a content of pelvis, not a content of abdomen. It's not present in abdomen, it's present in pelvis, and that also in true pelvis, the bony pelvis, right? And the rest of the options are correct. That ovary descends just like testis. Ovary also descends from the lumbar to the pelvic region during the development, and they are covered by peritoneum. They're suspended by this mesoovarium, and they are present since birth. Okay. So wrong statement will be that it's not an abdominal structure, rather it's a pelvic structure. Then last question is lining epithelium of urinary bladder is. It's a super hit question, need not to waste much time. Lining epithelium of urinary bladder will be called, you know, just a short fast diagram so that basement membrane, you have these simple cubical cells, like, you know, and then you have this important, these are now pear shaped cells, right? These are the multi-layered epithelium, so they're pear shaped cells. This is a multi-layered epithelium, and the top layers are said to be they're said to be umbrella shaped cells. Why umbrella shaped cells? Because they help to stretch. This epithelium needs stretching because of the dilatable, distendable viscera. So this is umbrella shaped cells on the top, and these are pear shaped cells in between, and these are the basal cells. Together, this epithelium is called transitional epithelium or urothelium. Another important point, like seeing in a microscope, when you see the microscope, under a microscope, like there are two epithelium, like we're talking about the stratified epithelium. One, let's say, is squamous stratified squamous epithelium. One is transitional epithelium. So in stratified squamous, like talking about the skin, like tongue, the lining epithelium of pharynx, the tongue. So you'll find a lot of nuclei present in the basal layer of the stratified squamous epithelium. But this epithelium, transitional epithelium, you'll find nuclei spread, equally, uniformly, right from the base to the luminal surface. Because why you don't find the nuclei in the top layers of stratified squamous epithelium? Because they are loaded with the protein containing vesicles, like keratohyalin, illidine, keratin, all those proteinaceous structures. They occlude the nuclei from being visible after being stained in, when you see in the slide. So transitional epithelium, it appears like this in a microscope. So I hope you understood the answer. Lining the urinary bladder will be transitional epithelium. It is done. Good luck.